doctors who kill. There's three categories here. Doctors who kill at the request of the state or the government. Doctors who kill at the request of the patient, euthanasia. And doctors who kill at the request of the parents, the unborn child, abortion. To talk about the first, doctors who are asked to participate in executions. Now this is a no-go area, and all associations and all regulatory authorities say you mustn't participate in executions or in torture. Now, if you go back to the Hippocratic Oath, written 2,500 years ago, it just transcends most of our laws of any country or any international body. Let me just read to you what the Hippocratic Oath actually says, an important part. I will prescribe regimens for the good of my patients, according to my ability and my judgment, and never do any harm to anyone. Well, you stick by that. Do you know, there's crazy government regimes in history, aren't there? Oliver Cromwell, 16th century England, the Nazis and all their terrible programs, Stalinist Russia, more recently Saddam Hussein getting doctors or asking doctors to cut off the ears of patients and torturing patients. Never participate in this. Even the US Supreme Court in the 60s said executions are okay. Now, or executions are not okay. Now they say executions are okay, but they've got some doubts. And they're saying it's cruel and unusual treatment. They want doctors to participate. You know why? Because most of these condemned criminals are drug users, have poor veins, so it's very difficult to put an intravenous line in. They don't know exactly what dose to use because they have all sorts of drug tolerance. They want you to go in there, put the IV line in as the doctor, an anesthesiologist, tell them what dose of drug to do, clean and rapid execution. Don't be part of this. These governments can't make up their minds. Our code, our Hippocratic code, transcends all this silliness. Now, the New England Journal of Medicine had a very good discussion on this in 2006, and it went over these very points. And they actually interviewed some doctors who are involved in this. Well, the doctors try to keep their identity secret, and they also stood behind curtains, so they knew they weren't doing the right thing. So don't participate in any of these executions or torture. The next thing is euthanasia. A patient asks you to kill them. Well, some ways doctors have been involved in this when patients are very, very sick and ill, and say full of cancer or some other terminal illness, and they're in pain and suffering. And doctors have always been helping in this area to alleviate their pain and suffering with high dose of narcotics or other medication. There's also some other dreadful cases where patients are brain dead and they're on ventilators or other extreme forms of life support. And we're not required by most moral codes to use extreme forms of life support or extreme forms of medication to keep patients alive. So we're all comfortable with this. We're a little less comfortable where it comes to using an injection or a large dose of oral medication such as Nembutal that has been discussed recently. I'm a little uncomfortable about that. It seems something final. And I just don't feel right about it. But I can understand doctors being involved in that, because your duty is to help the patient, isn't it? But there's another area where patients have lived in societies such as Holland or other European countries where they've had a great life, they've got no terminal illness, they feel fine, they feel they've achieved everything in life, but now they just want to end it all. And they just want to have the right to take their life. I feel uncomfortable about this. That they're asking you to execute or take away a perfectly good life. There's something terrible about this and a little cynical, don't you think? I mean, the societies provide them with a good life, food, shelter, good set of laws. Why don't they give something back to another society with people less fortunate? So, I'm very uncomfortable about that one. I wouldn't be involved in that. Now, the third category is abortion. And that's a very controversial issue, and you pretty much got to decide according to the laws of the country and your own moral code to what extent you're going to get involved. in this, and there's lots of debates and discussions about the unborn child, whether they're really a full independent human being. But just before you make up your mind to decide, let me just give you 3 situations that may influence or you should think about. First of all is, when I was a registrar trainee, there's a road in Sydney. You can walk down this road. If you're 20 weeks pregnant, turn left, go to an abortion clinic, end it all. Or you could turn right, go to this high-powered children's hospital neonatal unit where the neonatologists and intensive care units would struggle to save your child at 20 weeks. So left, death; right, life. There's a certain paradox and irony in that, isn't it? It seems as if our society, certainly Australian society, they don't really know what they're doing. Now, another situation, I recently went to a great exhibit in Sydney called Femme Fatale. It's about female criminals from the 20s and 30s. And in one room, they had a big room full of about abortion, backstreet abortion. It's a terrible business, when abortions are illegal. Poor desperate women had to go and seek the services of these people. And the back streets, look at this, dirty old crude equipment, and these people, young women, were subject to these terrible situations, and often they would bleed and they'd be just abandoned. Everyone would take off, just disappear, leave them to it, or they may be taken to a hospital in a desperate state with it, overwhelming infection, DIC, and left to die. Look at some of these backstreet abortionists. There's a room of pictures of them. Desperate, dirty looking people. My mother was brought up in this time as a nurse, clean, efficient, used to scrub the floors of the ward, so it didn't have to be like that, but it was. So, and in my medical career, when I started my medical degree, or during my medical degree, I was just at the tail end of these illegal abortion, backstreet abortion. It's a terrible thing. So we don't see this now with legalised abortion. It's all gone. So it's something to consider. And another thing, I've actually seen a mid-trimester abortion. The baby's formed, it's all cut up, dragged out limb by limb. I didn't do it. I just happened to see it. It's tragic. So, in forming your own opinion about whether you'll get involved in abortions, providing that service when you graduate, just have a little thought about some of the things I've said. So, in summary, we got doctors asked by the state or the government to kill, don't do it. Doctors asked by patients, euthanasia, to end their lives. Well, don't do it in extreme case, be very cautious, but you always got to help the patient. And then abortion, it's up to you which way you wish to proceed there.